medical experts giving us the lowdown on how to deal with asthma. They're with Manolo on UHA's Catch a Wave to Better Health.
Well, here with the good folks from UHA. First, we have Doreen Nakamura as well as Dr. George McPheeters talking about asthma today, and part of the problem being, well, in addition to, there's a few of them. What do you want to tell everybody there, doctor?
Well, asthma is a serious health problem, and unlike many chronic illnesses, it disproportionately affects young people. It's a major cause of emergency room visits, and we are concerned about it because, to a large extent, these acute flare-ups, which can be really terrifying for the patient, can be suppressed or prevented if people are compliant with their medicines, see their doctors, and work toward preventing those things which trigger their asthma attacks.
How much more does it affect children? I mean, is there a ratio like twice as much, or is there a lot more children affected by asthma?
In Hawaii, there are a lot more children affected by asthma, and I don't think anybody knows exactly why that's the case. The problem for children is that it can become an established disease which carries over into adult life. There is adult onset asthma, but it causes all sorts of social problems. They miss school, they can be awakened in the middle of the night with a terrifying attack, it's disruptive to the family, all of those sorts of things. And if they can establish care with their pediatrician or an allergist, they can really have a much better life, no question about it.
Doreen, certainly medication is a big part of trying to manage something like this. And as part of the problem, people not taking the medication?
Well, it's not taking the medication. A lot of it has to do with developing an asthma action plan with their physician. So in that discussion is recognizing what the asthma triggers are and what you can do, taking your regular control medications, and knowing when to take those rescue medications as well. So that asthma action plan with your physician is really crucial. What I've also heard is that people with asthma, even if they've had it for a long time, many times are not using their inhalers correctly, and they feel like they're fine. They don't need to take their medications, and that's when they run into problems a lot.
Confidence level goes up a little bit, thinking, okay, I don't need this anymore. One of the problems we have here all the time is VOG, certainly on the Big Island more so than here, and that's, I guess, something we can't control, but certainly you would want your medication, make sure you have it when you have in that situation.
Exactly. And the State Department of Health website, there is a VOG alert where you can check the sulfur dioxide levels. Okay. And if that's a trigger, and recognizing that that's a trigger, you can adjust your medications accordingly. And that again would be part of the asthma action plan.
Got to have an action plan.
Correct.
Certainly very important, very serious problem if you get into those kinds of problems.
Definitely.
More from Wake Up Today right after this.